So let's talk about overactive bladder. In America, 1 in 6 adults have overactive bladder. That's 35 million adult Americans are walking around with this problem. Overactive bladder are symptoms like having to go to the bathroom all the time. When you go out in public, you're constantly looking for where the restroom is. When you've got to go, you might have urgency, meaning if you don't get there in time, you're worried you're not going to be able to hold it back and you might wet yourself in public. These problems are devastating. They limit people's ability to do the things they want to do, get together with other people. They're isolating and traumatizing. People don't often seek care because they think, I'm getting older, that's just what I have to deal with. Or is there anything that even can be done for me? This is an extremely treatable problem, very treatable. Don't sit at home thinking there's nothing that can be done for me, because almost always there is. We do start with medications, but here at the Urology Clinic in Riverwood, we use a care pathway approach. That means we're going to figure out what's wrong. We're going to start with the minimally invasive approaches. These are often medications. A lot of our patients come in already on medications, but the reality is 60% of patients on medications ultimately find them either ineffective or they don't tolerate them well. Unfortunately, a lot of those patients never come to see me to figure out what else can be done. The treatments beyond medications are actually way more effective than the treatments of medications. What do we offer? We offer things like Botox injections for the bladder. We offer InterStim, sacral neuromodulation, which is essentially like a bladder pacemaker. These are minimally invasive, highly effective approaches for people with overactive bladder or urge incontinence. They also help people who have some bowel troubles, maybe difficulty controlling their bowels. So those patients too should consider coming in and seeing us, because this is very effective treatment for us. When you come in to see us, because it's a care pathway approach, the first thing we want to know is, what is your experience and how is your bladder actually functioning? So we might have you do a test or two to figure out what your bladder is experiencing, how well it's emptying, when it's spasming, these sorts of things. When we understand that, and we understand what you've already been through, we'll talk to you about all the options that are available. We might have you start medications. If you've already been on medicines, we may have you start a new one, because there are a couple of new medicines on the market that people may never have experienced before. After tests and maybe a trial of medicines or not, we'll talk more in depth about the treatment options that are available for you. One of these treatment options, bladder Botox, is actually an in-office procedure. You may never need to see the operating room. Others, like sacral neuromodulation, are OR-based, but they're so minimally invasive that it's rare to find a patient who doesn't tolerate them and tolerate them very well. So don't be scared. These treatments are nothing to be fearful of, and they're so effective, they're life-changing. So your next step is call the hospital. Ask for the Urology Clinic and you'll get a hold of us. We'll get you in and help you get taken care of.